Imagine someone you love with cancer. You cook their favorite meal. You beg them to eat just a few more bites. But they simply say, "I'm not hungry. Food does not taste right. I feel full after 2 bites." And the weight keeps dropping. Families often feel helpless and guilty. They feel like, am I not feeding them enough? But here is the truth most people don't know. Cancer weight loss is not the same as starvation. It's a medical condition called cancer cachexia. And understanding this condition can change how we care for our loved ones. Today, I will explain why cancer patients lose weight, why forcing food often does not work, what treatments actually help. I am Dr. Pachipala. I'm a board-certified hematologist and oncologist, and I practice in Greater Houston area. Please like and subscribe to our channel for more information like this. So what is cancer cachexia? Cancer cachexia is a complex metabolic syndrome seen in many advanced cancers. The key features are, number 1, loss of appetite, number 2, loss of muscle mass, number 3, loss of body fat, and unintentional weight loss. More than half of cancer patients experience this condition. And importantly, the weight loss is not simply due to eating less. Something much deeper is happening inside the body. The key point to remember, in simple starvation, eating more fixes the problem. In cancer cachexia, eating more alone does not fully reverse the weight loss. That is why forcing food often does not solve the problem. So why does this happen? Number 1, inflammation. Cancer releases inflammatory chemicals called cytokines. Important ones include tumor necrosis factor or TNF, interleukin 6, interleukin 1. These chemicals create a hypermetabolic state and suppress appetite. Suppressed appetite means you eat less food. Number 2, metabolic changes. The body begins to break down muscle protein, break down fat stores, burn more calories at rest. So even if someone eats reasonably well, their body is still losing weight. That is why cancer cachexia is so frustrating for families. It's not about willpower or trying harder to eat. Number 3, treatment side effects. Chemotherapy and radiation can cause nausea, taste changes such as metallic taste, mouth sores, early fullness, constipation, fatigue, makes you nauseated. Naturally, you stop eating. Let's discuss about why cancer cachexia matters. Cancer cachexia is not just about appearance. It has real medical consequences. Patients with significant weight loss may have lower tolerance to chemotherapy, more fatigue and weakness, higher risk of complications, shorter survival. Even a 5% weight loss before starting cancer treatment can predict worse outcomes. That is why doctors monitor weight very carefully. Let's discuss about what families should know about this condition. One of the hardest parts of cancer cachexia is the emotional side. Families often feel that feeding equals caring, but forcing someone to eat can actually cause nausea, vomiting, choking risk, and may actually increase suffering for patients. And remember something very important. Sometimes the pleasure of tasting food matters more than the total calories eaten. Our job shifts from pushing calories to reducing distress. So what can we actually do about this condition? Let's be practical. Step 1, look for reversible causes. Some of the questions we ask: is nausea controlled? Is pain controlled? Is constipation present? Is there depression? Is there uncontrolled anxiety? Are medications causing sedation? Fixing these sometimes improve appetite. Number 2, nutritional counseling. Instead of 3 large meals, try small frequent meals, high protein, high calorie foods. Try your favorite foods. No strict dietary restrictions. Calories matter more than perfection. And step 3, effective treatment of cancer. By attacking the root cause of symptoms, we make improvements in appetite. Number 4, medications. Let me discuss few medications we use to help with appetite. These drugs can also cause modest weight gain. They do not cure the condition. Common options that we use typically include olanzapine. Olanzapine at low doses like 2.5 milligrams can improve appetite, reduce nausea, help people eat more. Number 2, megestrol acetate, a hormone medication that can stimulate appetite, increase body weight, but it can potentially increase the risk of blood clots and fluid retention. Number 3, steroids like dexamethasone. These can temporarily improve appetite. and also improves sense of well-being. But long-term use has side effects. So that's the reason why doctors use steroids such as dexamethasone carefully. So number 5, can we use feeding tubes or IV nutrition? Do they actually help? Many people assume that if the patient can't eat, just give some nutrition through the tube or IV. Unfortunately, in most advanced cancers, this does not reverse cachexia, because the problem is metabolism, not just calorie intake. Feeding tubes or IV nutrition are usually reserved only for specific situations like bowel obstruction, severe malabsorption, short bowel syndrome. So for most patients, the focus is comfort and symptom control. So in conclusion, cancer cachexia is one of the most misunderstood parts of cancer care. It's not simply lack of eating. It's a complex metabolic condition driven by inflammation and tumor biology. For families, the most important things to remember are: don't blame the patient for not eating, avoid forcing food, focus on comfort and small enjoyable meals. Discuss appetite-stimulating medications with the doctor. Sometimes the greatest support we can offer is simply being present, sharing a meal, and making the patient feel cared for. Because in cancer care, compassion is just as important as medicine. Please like and subscribe for more videos like this. Thank you for watching.